Welcome to I Can I Will, a courage intervention brought to you by the Office of Health Promotion. The model we will discuss today is specifically related to COVID-19. There are other areas covered through this model around hazing, sexual violence, diversity, alcohol and other drugs, mental health, and bullying. What will you do if you see someone without a mask in a public space, whether it be in class, in a residence hall, in the sunken gardens, or a building lobby? Most generally, people can ignore behavior that bothers them because usually it does not affect them personally. This is not the case in this environment. Someone not wearing a mask can affect us all, even if we are not in close proximity to the person. One carrier of SARS-CoV-2 can potentially infect many people, whether you get sick or not. If you come in contact with someone who is positive, you are required to quarantine. So what do? Do you ignore it or do you say something? This presentation is designed to help you prepare and think through how you might intervene. The barriers to intervening. We will discuss the role of personal values in intervening and cover the steps to intervening. I Can I Will is an intervention designed to increase one's courage in acting on their values and intervening in a situation. This intervention is not about being fearless, but managing one's fear and acting on what is important to them personally. Values are basic beliefs that guide our decision making, motivation, and behavior. When we look at the word cloud, we see words like teamwork, honesty, respect, trust, responsibility. Take a minute and think about your values. Think about what's important to you. During this time, things may come to mind like wearing a mask and physically distancing, or washing hands. I've heard students say, we look out for each other, we take care of each other, which identifies a value of concern for others. As an institution, William & Mary values the safety of students, faculty, staff, and visitors. Acting on these values will go a long way in helping us successfully get through these times. If you'd like to dig a little deeper and see what values are salient for you at this time in your life, you can take the Life Values Inventory at www.lifevaluesinventory.org. The LVI is a free values clarification and personal development program. You can also look for authentic excellence presentations on campus. Before we go further, let's discuss courage. We know that when you intervene based on your values, when you step into right when it is hard, you are being healthy and courageous. Let's talk about courage for a minute. Courage has many meanings. When we use courage in this model, we speak of two types. Moral courage, standing up for what is right despite possible social condemnation. And personal courage, actions which are only courageous given the context of the actor's personal limitations, whether these limitations are real or perceived. It may seem easy to act when you feel internal pressure to do so. However, sometimes that internal pressure is not enough to encourage people to step in. So, why do individuals not intervene when that internal pressure tells them something is out of order? The answer is barriers. There are many barriers to intervening. It may be the person's knowledge, skills, confidence, or sense of social responsibility. It may be the situation. The situation may be triggering and the person internalizes the situation too much to act. Or you believe someone else would do something, or someone else is more qualified to help, and you shift responsibility to others, which is the diffusion of responsibility. If you are alone, others in the situation may not be responding, thus you doubt yourself and think a response is not necessary. Evaluation apprehension, which means you are concerned about being evaluated or judged by others, so you do what makes you fit in. Or it may be a potential risk of danger. Gender, culture, and social roles can also play a part here. These are social constructs based on our identities in society, which can be disempowering to those who want to intervene. The final barrier we will discuss is the other party. Do you know the person? Do you think they deserve help? Do you think they will accept help? Do you think they are similar to you? In the case of masking and distancing, do you think they will listen to you? Is this person in a position of authority? These are all reasons why individuals may not intervene. It is important to be clear about this. If you are stepping into a situation that could potentially be dangerous, you may need to call for help. If you are okay with the risk, act. Otherwise, you may want to call professionals. Take a minute. Think about a time when you intervened in a situation. What inclined you to do so? Now, think about a time you did not intervene. What discouraged you from doing so? Individuals make decisions based on a few things, two of which are values and emotions. When asked why someone did not intervene, most often the answer is either I was afraid and or I didn't know what to do. When asked why those who intervened did so, the answers were it was the right thing to do. I couldn't just watch. I had to do something. The question is, when the internal pressure implores you to act, what enables us to be courageous and act on our values and overcome our fears? Let's talk about the steps to intervening. The first step is awareness. In this day and age, it's easy to find yourself distracted by some device and miss a lot of what's going on around you. Yet, during this time, there might be a hyper-awareness, which means you might see more than normal, which is okay when it's managed well. So, the first step is being aware of your surroundings. The second step is analysis. Now that you see something may be out of order, you must analyze the situation and consider what is right or wrong about the situation. If you feel like you are the only one that deems something out of order, do not dismiss your intuition. If there is an internal pressure telling you something is out of order, listen to it. Now you find yourself at a decision point where you know something needs to happen. You consider, how can I approach this in this environment? What are the risks of action and how can I manage those risks? What is the most effective response? While this may seem like a lot, our brains are awesome computers that can do this in a matter of minutes or sometimes seconds. Once you have analyzed the situation, you must assume responsibility, which is our next step. Find that smallest arc. Find what you can do. Do not be deterred by the things you feel you cannot do or are uncomfortable doing. Courage comes into play when you do what you can. You may think, well, if I assume responsibility, I will act. That is not always the case. Many people assume they should do something but fail to act because they may not know what to do. So, the final step is important while it may seem obvious. When the internal pressure implores us to act, what enables us to be courageous and act on our values? Dr. King once said, heroism is having the courage to act daily on your values. Brene Brown once said, I don't think you can be courageous without uncertainty, risk, and emotional exposure. You cannot be courageous and comfortable. Kelly Crace and his colleagues define courage as stepping into right when it's hard. Anytime we do something that is right and hard, it is courageous. The question was, how do you become courageous and act on your values? The answer is practice. We can discuss intervening from sunup to sundown, but if you do not practice, it will always be a challenge to intervene if your intuition implores you to do so. Some of this is because many might not like conflict or try to mind their own business. Yet, when there is internal pressure telling you something is out of order, you can keep silent or act. When it is all said and done, if you suppress your voice, it will become easy to ignore your intuition. And if you suppress your voice long enough, you will never intervene. So what do if you see someone without a mask in a public space, whether it be in a class, in a residence hall area, in the sunken gardens, or in a lobby of a building? Most generally, people can ignore behavior that bothers them because usually you may not be personally affected. This is not the case in this environment. Someone not wearing a mask can affect us all, even if we are not in close proximity to the person. One carrier of SARS-CoV-2 can potentially infect many people. Whether you get sick or not, if you come into contact with someone who is positive, you are required to go into quarantine. So, what do? Do you ignore it, or do you say something? I stated practice was the best way to find the courage to intervene when your values employ you to do so. There is no way of knowing what one might encounter from day to day. When it comes to intervening, I cannot tell you what you should or should not do. I can say that if enough people intervene, that is how and when a culture changes. Peer pressure is powerful. While people like to be different, they don't like to be different. So, let me give you more food for thought. What do you do if you see groups of people gathered not distancing like you would like? Do you say something? Do you ignore it? What if a student takes off a mask during class? Will you as a professor ask them to leave? Will students assume the professor or teacher will ask them to leave? Will diffusion of responsibility win the day? What if you see someone leave the bathroom without washing their hands? Will you say something or ignore it? Now, most of you have seen this and thought nothing of it. But in this environment, does anything change in your perception of such behavior? What if you hear your peers saying they are having a party or gathering, or have attended a party or large gathering? What if your coworkers don't wear a mask? What if they are in the break room with no mask and it seems to you they are not distancing as we are required to? Should you talk about it before you report them? What if one of these individuals is your supervisor? I could go on and on with the what ifs. The bottom line is, I do not know what situations you will encounter. You do not know what type of situations you will encounter. But you should be thinking about it because something is likely to happen in your presence. I will challenges you not to get caught in the things you cannot do and find that one thing that you can do and do it. It may be walking up or walking by and saying, hey, we are required to wear masks in public spaces. Or, I'm choosing to wear my mask to protect others. Would you do the same? Or, we are required to be physically distant. Or something like, hey, don't forget, we're supposed to wash our hands for 20 seconds. Maybe, I don't know about you, but I don't want to go home. Please fill in the blank. Or, would you be so kind as to fill in the blank? This may not get the desired result. The person may ignore you. What is important is you acted on your values. You did your part, and you can rest on that. Another thing to consider is, or understand, is when you intervene, you cannot control the outcome. Things may not turn out like you want or imagine. That should not be an impetus for your not intervening. The point is to act on your values. Note, when you choose to intervene, do not shame or be overly aggressive. If you choose to act, speak to the behavior. Don't try to embarrass anyone. And try not to make people feel like they're under attack. This is never helpful. I will is an intervention designed to increase one's courage in acting on their values and intervening in a situation. This intervention is not about being fearless, but managing one's fear and acting on what is important to them personally. So, if someone not wearing a mask does not bother you, keep it moving. If you are fine with groups congregating and feel it's not a problem, keep it moving. Just know, If we fail to intervene when we can, and it is determined that our campus is unsafe, the institution may be forced to go remote, which affects us all. Just food for thought. What options do you have? If a coworker refuses to follow guidelines, you may need to report it to your supervisor. If it is your supervisor, you may need to go to their supervisor. If you are a student living in a residence hall, you may have to report it to your RA. If you're an RA struggling to intervene in your area, you may have to go to your area director. If you teach a course, consider adding something in your syllabus about requirements in your class. Some professors have a class disruption component. Failing to wear a mask could fall under this piece. You can also contact our COVID Concern team at covidconcerns@wm.edu. What other options are available? While you should not share every infraction in a CARE report, if something is egregious, a CARE report is the right place to go. What's egregious? You have to decide. From my perspective, it will be a student that refuses to wear or keep a mask on in your class or in public spaces, or someone coughs on you intentionally. I understand reporting to someone in authority may be difficult, but this is where courage is important. This is where stepping into hard and right meet. I challenge you to find the courage to overcome your fears and do what you can. After you do your best, you may have to change your course to save your mental health. Take another direction to class, or ignore the ignorance. I have discussed some options when intervening. That may not seem like enough, but you'll be surprised how, if enough of us intervene, we can change what is acceptable in our community. Maybe you cannot find the courage to intervene, or you have said something a couple of times and are getting no results, or you have gone to an authority for help. What do you do then? You keep acting on your values. Understand that by wearing your mask and physically distancing, etc., you are leading by example. In closing, you may not be happy with some of the remedies in this presentation. You may want more. You may want to have a long conversation about why wearing a mask and physically distancing is important. If that's the way you feel you need to intervene, you are welcome to do so. Or you may want specific ways to intervene. That will be futile. When it comes to intervening, there's no one size fits all. There's no one way to intervene. Courage is stepping into right when it is hard. Anytime we do something that is right and hard, it is courageous. Again, I Can, I Will is designed to encourage you to not be hindered or deterred by fear, but act on your values and do what you can, and not become paralyzed by what you feel you cannot. Remember, when you find yourself at a decision point where you know something needs to happen, consider, how can I approach this in this environment? What are the risks of action and how can I manage those risks? What is the most effective response? I acknowledge it may be challenging for some to continue to intervene if they have acted and nothing changes. Recall, this is about you acting on your values. The fact of the matter is, you cannot control the outcome. If it works out like you want it, great. If not so much, still great. You know you acted on your values and did your part to make our community safer. Remember, courage is not the absence of fear. It is the ability to act in the presence of fear. If you would like to discuss values and intervention further, here are some resources. If you'd like to see how people act on their values and intervene, check out ABC's What Would You Do on YouTube.